Good morning, good afternoon, good evening to everybody, wherever you are. This session is about antimicrobial resistance, and I'll be starting with a landscape view of the experiences and lessons that we have learned from implementing multisectoral coordination activities and other AMR activities across 11 countries. Next slide, please. This is the outline, and in the interest of time, I'll not go over in detail. I'll start with the fact that MSC, when I say MSC, it will mean multisectoral coordination from now onwards. So I'll talk about the recognition of MSC as an important approach, and then go into what MTaPS is doing, and the benchmarks, actions that MTaPS is supporting. And then we will be identifying some of the promising practices that we have seen and the challenges, lessons, and conclusion. That's how my presentation will flow in the next 11 minutes or so. Next one, please. So MSC has been recognized as a critical approach in containing AMR, as is evident from the fact that it is highlighted very well in the WHO Global Action Plan on AMR, the Global Health Security Agenda 2024 framework, the GHSA AMR Action Package, the JE, the Joint External Evaluation Tool, actually includes a dedicated indicator on it now, the second edition, P3.1. And also the WHO benchmarks for IHR capacities has provided recommended actions to raise the capacities of countries in this area. And we've seen that the Ministerial Meeting this year is providing a lot of emphasis on multisectoral coordination as well. Most of the countries in the world now have national action plans on AMR. What really is required is their operationalization through effective MSC. Next slide, please. USAID MTaPS is a pharmaceutical systems and technologies strengthening program and working across multiple countries in the world. And GHSA is a major portfolio within our program. And through GHSA, we are supporting the containment of AMR. And we are addressing 3 of the 4 indicators that are included in JE. Which are P3.1, that is multisectoral coordination and AMR. The second is IPC, infection prevention and control, P3.3, and antimicrobial stewardship, P3.4. Our aim is to raise countries' capacities as per the JE and WHO benchmarks actions. These are the 11 countries that we're working in right now. 2 have been added, so making a total of 13 countries. Bangladesh, Burkina Faso, Cameroon, Cote d'Ivoire, DRC, Ethiopia, Kenya, Mali, Senegal, Tanzania, and Uganda. Next one, please. This slide may not be all that self-explanatory, but in the interest of time, we will go over quickly. So WHO benchmarks actions, they actually have recommended specified actions for each capacity level 2, capacity level 3, capacity level 4, and capacity level 5. And in MSC AMR, we have supported activities in 3 of the capacity levels, level 2, 3, and 4. Like, for example, in Burkina Faso, the top left, the bar represents 50% of the actions recommended for that capacity we have supported. So which means there are 4 recommended actions for that capacity level, and we have supported 2 of them. So this graph actually describes the different actions for each capacity level that we have supported across all the 11 countries on MSC AMR. I want to clarify, though, that this slide represents the work supported by MTaPS in collaboration with the national counterparts. This does not reflect the activities of other partners. Next one, please. As Julie said right in the beginning, I think one of the important objectives of this session is to identify promising practices that can then become tested more widely and then become established best practices that GHSA can and other partners working in the area of AMR can disseminate globally in the end. And that is what is really intended in the Global Health Security Agenda 2024 framework as well. By 2024, there is a expectation to compile and disseminate best practices. So this is the from our experience and lessons that we learned from working across the 11 countries. We have identified some promising practices, and then we've tried to group them into three areas. The first promising practice is strengthening governance of the multisectoral coordination on AMR bodies, the bodies themselves, improving their structures, making the bodies diverse, and then enhancing their vertical coordination. On the right side, the right column shows some of the examples of our activities that contribute to those actions. For example, for improving structures, we have improved the TORs for the bodies in across all the countries, and then helped establish IPC and AMS technical working groups or improve their TORs. And we have also improved their functioning through agenda-driven regular meetings that get disseminated and then followed on afterwards. And making the bodies diverse, for example, including CSO and journalists in Cote d'Ivoire and the private sector in Kenya and the National Health Insurance Fund in Tanzania. And enhancing vertical coordination, uh, both upstream as well as downstream. Upstream with the One Health platform. For example, the One Health is represented in all the quarterly meetings of the DRC multisectoral coordination body. Downstream, we are helping with supportive supervision in the facilities. Next one, please. Julie, next slide, please. Thank you. No, go back, please. Thank you. While it is important to improve the structures and governance of the multisectoral bodies, it is equally important to help them to identify how best to facilitate the implementation of the national action plans on AMR. Because ultimately, whatever we do in the area of AMR is to actually contribute to operationalizing the NAPS. That is what is the ultimate game plan anyway for all of us. So some of the examples of the contributing actions that support this promising practice is we have seen that helping countries to review, document, and disseminate progress on NAP implementation is a very good starting point because that really provides a landscape and a mapping of what has been done, what the gaps are, and what the priorities are moving forward. That is what we did in Bangladesh, and really it was through a One Health approach. The animal sector was very highly engaged in that exercise. And we've also supported the tripartite AMR country self-assessment surveys in DRC and in Ethiopia. Now, that is a process that feeds into WHO's annual reporting on the progress made by the countries in operationalizing action plans. The second is it is very important to have advocacy meetings and then say that multisectoral coordination is important, actions are important, but it is important also to use them as a springboard or a means to catalyzing specific actions on AMR containment. Like for example, in Mali, we helped to do AMS assessments followed by action plans. And in Cote d'Ivoire, IPC assessments, guidelines, plans, and training. So these are specific technical areas that the MSc bodies have contributed to. And then developing tools that facilitate implementation. For example, monitoring and evaluation framework in Bangladesh and Kenya, and operational plan in Cameroon. Next one, please. Promising practice 3, improving institutionalization and sustainability of the MSc bodies. Many times bodies get formed and they, after some time when the donor support and other interests, opinion leaders or, people who are taking care, they move away, they tend to fall apart. So institutionalization and sustainability is critically important. And one of the ways that we can do so for AMR is mainstreaming AMR into the broader national agenda and plans, such as the universal health coverage, SDGs, quality improvement and quality of care, patient safety, and such national, bigger national agendas like, and for example, another one is mother and child health, MNCH area. Like, for example, in Burkina Faso, there was a very big environmental conventions attended by parliamentarians, and we took that opportunity to educate and sensitize those parliamentarians on AMR topics and the role of environment in that. In the same way, we have supported AMR, integrated AMR into the ongoing quality improvement initiatives. And then making documented funding mobilizations is critically important. We have helped develop and submit finalized concept notes for tripartite AMR multi-partner trust fund. This is a new mechanism that the tripartite has developed for LMICs to apply and get funding to do tripartite, the One Health type of work to support AMR containment. And then building on existing initiatives. Next one, Julie. The challenges that we have seen is one of the biggest things that we have seen across several countries is that MSc-AMR bodies have been formed. That's great, important, because the Global Action Plan on AMR stipulates that, and the National Action Plans also say so. So the countries quickly went into forming the bodies, but they really have not been supported through enabling environments like enabling policies and funding for their efficient function. Another is animal sector is increasingly getting integrated into the AMR response, which is a great thing that is happening. But we need to be doing so exactly for the environmental sector also, because the environmental sector is still very weakly represented in AMR actions. That is our experience across all the countries. Their involvement is very little, if any, or next to nil in reality, in actual reality. And then there is also a need to move beyond joint meetings, commitments, and advocacy. I already talked about that, into designing co-activities, designing and implementing real co-activities where the One Health actually is operating together, like joint surveillance, joint education, joint review of the laws and policies and regulations, and the joint communication and coordination. And then the last challenge is the ministry reorganization, often happening in LMICs, and staff transfer is a challenge because the institutional memory tends to get lost through that challenge. Next one, please. The lessons learned, that additional lessons, we can see them as promising practices as well as lessons learned. One of the things is we tested the use of the benchmarks actions, the WHO benchmarks on IHR capacities, the recommended actions, and we found that the tool really helps to support capacity level appropriate actions in the countries. Because it provides an organized thinking so that we can pick and implement the right ones, and then standardize and cross-fertilize actions across countries because the actions tend to be similar in nature. Another one is we have seen is another lesson and experience that we got from this activity was the MSc-AMR body actually tends to have a value larger than in the AMR sector. Like, for example, the bodies or their technical working groups or their members were able to quickly get mobilized to support COVID-19 response, the national COVID-19 response very quickly in 9 of the 11 countries. And then also one more key lesson that we saw was that implementing combination multimodal approaches in the same facility really tends to provide a bigger bang for the buck, greater outcomes, synergy in action, and cost effectiveness. Like, for example, we are supporting IPC and AMS activities in 64 facilities across 7 countries that we're working with. Next one, please. In conclusion, so this is my last slide. In conclusion, the as I said before, the AMR structure, governance structures are there, but they do help in strengthening their structures, management, and functioning. And we have seen that MSC is critically important to realize the containment of AMR in a comprehensive manner, and also to actually move the concept of One Health into actual practice. So our experience in across 11 countries, and in the next couple of years or so, we'll have experience from 13 countries, have helped to identify some lessons and experience that we try to organize into promising practices to serve the objectives of this particular session. And hopefully such initiatives by us and by other partners, national and international partners, probably will help the global community to collect, compile, and share the best practices that we urgently need in various technical areas, including AMR, as is stipulated in the GHSA 2024 framework. I end my presentation here. That's all I wanted to say. Thank you very much for your attention. Over to you, Julie.